So, greetings and welcome back to day 2 of the Rural GP Network Conference. And the theme for this next section is going to be on information technology. And I've got 3 guests and possibly a 4th might be on its way. We'll see whether the phone call to him worked. First I've got Andrew Bowers and wearing numerous hats. I know you as a physician in Dunedin, but you've got a different hat on. And we've got Craig from Chorus and Becky from Vodafone. I'd love to start very briefly. You could introduce yourselves and what exactly your role is with IT, and then we can have we can just let it flow. I think the interest from the watching audience is really our reliance in rural health on information technology, and so I'm hoping that we might emerge in a few minutes with a few answers and a few anxieties quashed. So, Andrew, the floor is yours, sir, and you can tell me your interest and why you're sitting on the chair there.
Well, because you collared me there, Buzz.
Well, moving right on.
But I've got a background as a general internal medicine specialist, and a number of years back I branched out into information technology. Currently I have other roles as well. I'm now the chair of the South Island Information Systems Alliance, and I am also the medical director for the DHBs of the South Island as far as information systems go. I've got about a few more large projects underway at the moment. One of them is to have a single electronic medicine prescribing system for hospitals across the South Island. We're well underway with that. We're redeveloping a patient administration system across the South Island. We're looking at a single process for electronic referrals with a referral management system inside the hospitals. And we're looking at having a single patient viewer across the South Island for hospital staff to access results, and that will be also available in the community to general practitioners.
So that will be embraced in the primary sector as well as the secondary sector?
Certainly that's the intent, but that's quite a job. It'll take a number of years before we're fully there.
Didn't anticipate it was a weekend's project you've got on. That's a huge task. If we can come back to that, because I'd love to introduce these next 2 guests, and then I'm certainly they'll dovetail into your interests, I'm sure of it. So, Craig, if you could possibly just expand more on your role with IT and.
Yeah, no problem, Buzz. I'm a recovering patient, I suppose. It's about my only connection with the health system. I've been in telco for about 15 years now, and I'm currently the head of industry relations for Chorus. That means I get to spread the good word about the increase in broadband, the stuff we're doing with fibre, with upgrading DSL in the rural communities, with bringing fibre to Vodafone services to allow them to provide their services. Becky can talk about that. And I also get to work with all the players in the industry, so all the service providers. Not sure if you know, but Chorus doesn't sell anything directly to end users. So we rely on our service providers such as Vodafone and Telecom, Call Plus, you name them, they sell our services. So that's my role.
Excellent. Well, thanks for that intro.
Right.
And Becky.
Hello. Yep.
Greetings.
Hello. I'm Becky Lloyd. I'm from Vodafone. I'm the General Manager of Business Marketing, and I'm responsible for our marketing activities across all sizes of business, but I've got particular interest in the Rural Broadband Initiative and delivering Vodafone's commitment to the Rural Broadband Initiative, working closely with Craig and Chorus on that, as well as, I guess my claim to connection with the health service is quite tenuous. My mother was a GP, so I know the key role that good communications plays in general practice, so I guess that's my affinity with this area.
That's wonderful. No, it's a good qualification. We can go with that one. Was she a rural GP just out of interest, or is she?
No, she was more of an urban GP.
Yes. That's all right. We'll still let you in. You've done well there. And Stu gave me this wonderful quote, which I thought would just throw the cat amongst the pigeons and get us all going. And it's something the ex-CEO of Telecom, who made a point of stressing the Teresa Getting, when she said, quote unquote, "Let's face it, the fact that we've been able to make our technology look complicated has been the single most factor in maintaining our pricing structure." Don't you just love that, huh? Now, if she said that to you, how would you have responded to that?
Oh, I'd say that's quite some time ago she must have said that.
Yes. Quite a while ago.
World's moved on.
That was a politically correct answer. Well done. Bless you. I think probably to all 3 of you, and I'd be interested as well, Andrew, whether this applies to you, but certainly in the rural sector, a lot of practitioners and indeed patients are reliant on IT and certainly reliant on telecommunications, and you will know better than I, there are large areas of New Zealand which is suboptimal, I think is a very polite way of putting it. I said that without swearing, whereas some of my colleagues cannot construct a sentence without swearing. So certainly for the viewers, I think they would be genuinely interested to know, respectfully, what are you guys doing to correct these deficiencies, and when can we look forwards to having a safe means of communicating with colleagues, which we need to be able to do?
You want to go first on that one?
You can do the RBI intro.
Sure. The exciting thing about working for Chorus is we do the pipes, I suppose. Was that the exciting thing? We're providing the base layer of broadband access out into the rural communities through the RBI project, but also through our own funding. And RBI, both Vodafone and Chorus are putting their own money into this project. This is not just government funding it, although the government's putting 300 million in. I think the exciting thing is you haven't seen the exciting stuff really yet. We're really doing two main things. The first thing is delivering fibre to schools. You will see that happening. We're a long way through schools. More than half of 1,000 rural schools are connected to fibre already. But in the second part of the program for us, it's upgrading what we call the DSL network, the cabinets that feed standard broadband to communities and townships. And most of that builds in the second half of the program, so we're heading into that now. So I think from rural communities, you'll start to see people that haven't had broadband previously will start to get access to that, and good quality broadband. You know, we're talking world-class copper-based broadband, and also those that are on waiters lists, that have been sitting there waiting for it, or are just getting a really poor performance, will start to see over the next coming couple of years, a real lift in their broadband performance, and they won't have to do anything about it. It'll just happen for them. So that's the bit we're doing, and we're providing a hugely future-proof base layer in the fibre that's rolling out to every school, but it's going past communities, going past rural health centres. We're connecting 51 hospitals. That's all going to be in place that we can then build on into the future.
Is there a timeline on that which we can look forward to?
Our project finishes in 2015.
Right.
That's the RBI project, so it was a 5-year project. We're just about to head into year 3. And we're already starting to think about, with our service providers and other infrastructure providers, what will we do after that? What else can we do jointly to look after the rest of the community that isn't getting anything.
Maybe we'll get back to you on that one in that case.
Sure.
Becky, can you tell me in that case from your end?
Yeah. So we're the next part of it. So as Craig said, the Chorus guys are laying this incredibly fast fibre all the way through the country and reaching into rural areas where it hasn't reached before. We are putting up new cell sites across rural New Zealand and upgrading a whole bunch of existing cell sites. So the commitment is 154 new cell sites are being built over a 5-year period, and 384, I think it is, are being upgraded. And so we're roughly 2 years into the programme. So far we've upgraded 135 and we've built 35 new ones. And so we're gradually rolling that out across the country, and every time we light one up, we tell the local community. And that's giving New Zealanders 2 things. First of all, better mobile coverage. So by the end of the 5-year period, there'll be an extra 6,200 square kilometres of New Zealand covered by mobile. And it's also delivering a service called wireless broadband. So the places that can't get a fixed pipe connected to them can get wireless broadband. And what that does is it takes a mobile signal and it converts it into a broadband service within the household. And so we're seeing really good take-up from that. The other thing I would say, just going back to your point about customer experience and how customers feel about it, one of the things that we track at Vodafone is our customer satisfaction with our services, and we specifically look at the rural segment. And over the last 6 months, we've seen a really big increase in what we call NPS, Net Promoter Score, which is a measure of customer satisfaction, because as we roll out this coverage and give this service, customers are starting to get more and more happy with the service that we're delivering. So where it's reaching, we're getting really good response. So I hear what you're saying. Yes, it takes a while to roll it out, but we're well on the way.
We respect that you're working on it. I appreciate that. So finally, possibly in 5 years then, we've got a very few black spots, or is that a bit too optimistic?
Well, this is the last 3% question, isn't it, Craig?
It is. Yeah. And that 3% is not just at the fringes, it's all over the place, because you've got, if you think about driving up from Wanganui up to, the volcanic plateau, there's valleys all over the place that, we could put cell towers everywhere to cover that sort of stuff, and you just can't do that.
You still can't get right into
the one other thing I'd say, Buzz, just not to put a damper on my friends from Vodafone, but the network that we're rolling out, the way the course is structured, is that network's available to all service providers to use. So whether it's our friends at Vodafone, who we're working very closely with, or with Telecom, 2 Degrees, anyone else that wants to use that technology and that service, that's there for them to buy it as well.
And on that note, I should say wireless broadband similarly is a wholesale service, so other providers can sell wireless broadband as well. So not intended to be complicated, but it actually offers competition.
No, you're doing it extremely well.
Yeah.
So Andrew, from your perspective, is this good news? Does this affect you, or are you in a fool's paradise and you're not struggling like we are?
It's absolutely essential to the way we're moving in the health service. We are going to share information between district health boards, between general practitioners and between hospitals. And that is a lot of information. We're going to be sharing pictures, we're going to be sharing radiology results and other such things that need to be delivered in a timely manner for it to be effective.
And is the infrastructure already there for that, or are you relying on these rollouts we're hearing about already?
We're certainly relying on the rollouts, but we've actually had a large amount of it already put in place. For example, Dunedin, Christchurch, Invercargill, Nelson, Marlborough and West Coast are now linked by some very, very fast pipes that we only dreamed of a little while ago. And that enables us to share information in real time. It also means that we can actually have telepresence. We can have multidisciplinary meetings where we sit in one hospital and link directly to people in the other hospitals and share, for example, pathological slides where we can share radiological information in real time across those distance barriers. It's made New Zealand a very much smaller place, which is a good thing from point of view of health delivery.
It's well put. And bearing in mind, we were talking about this earlier on today, where the ministry is very looking at devolving quite a lot of work from the secondary down to the primary sector, and so our primary rural workforce people are going to be even more reliant than they have been to date, which puts more pressure on you two, of course, doesn't it, to do that. So to that end, what feedback have you had already, apart from me, from my rural colleagues, and how are you responding to that?
Feedback in terms of what?
The health providers saying help. What help are you being asked?
I mean, you're getting a lot of questions about when fiber's coming, aren't you?
Everybody's an end user.
That's the main question.
So not only do they want to know when their health centre may have access to fibre or fast broadband services, they want to know when it's coming to their house. Doesn't matter where they live. And you can guarantee you have to answer both of those questions. And that is fine. That's what we're here for. I mean, we're here to bring some sense of excitement to the rural sector as well, and to the health, so that these guys, with all their exciting, whizzy, bang, awesome things that they can do and want to do, that we can actually, they don't go bang, yeah, that's right. Bing. Yeah, that's right. So that we can actually connect them up and make sure the network runs. Yeah.
That's first class. So for the end users, especially my colleagues who hopefully be watching this, how much warning will they know that their current black spot is no longer going to be black?
We've both got we've both got coverage maps, so the fibre coverage map and the mobile coverage map on our websites, which show coverage today, but also what's coming.
Oh, very good.
Under RBI, so people know whether it's 3 months out or 2 years out.
And we can access that obviously just online. And have a look at that.
And we both have to go through the country again shortly through 15 different regions to bring them up to date with how our plans are going as well. So they should look out for their regions getting that information as well.
That's first class. We've got 3 minutes left, and that's very convenient because I've got three of you. I did this in the previous interviews, and the responses were completely unpredictable. So I'll start with you. If I was a fairy godmother, which is very easy to imagine, and I've got a magic wand, and I can grant you one wish, and it will just happen. Keep it clean. There might be children watching this. What would that one wish be?
Oh my goodness.
Well, I think that one of the problems I face is that particularly doctors absolutely love progress, but they absolutely abhor change. I think what we need to be able to do is move together to actually decide on where we want to go and share that vision. I think we've got a great infrastructure in New Zealand now. We've got the National Health IT Board, which is a really great resource for us, and we also have regional alliances. We need to take that right out to the end user and get them to come on that journey. If they could do that, my job will be, I'd retire.
That was a very unselfish wish. God bless you. That's excellent. Now, Craig, your turn.
Well, I mean, that's a really hard question from an infrastructure provider. But I mean, if New Zealand could be flat with alluvial soils rather than any volcanic rock, it would be like our job would be a lot easier to be able to roll out networks. But I think what it would be for me would be for people to realise how exciting this stuff is and to actually make the use of it, so that they actually talk to their service providers and say, when can I get this, when can I get this, when can I get this.
That's awesome. And Becky, you've got the last word in the last minute. You've got one wish.
My wish is kind of a blend of these two guys, because I think it's about embracing the future, and it's about New Zealand's health community really embracing the power of communication and smart technology and innovation as fast as we possibly can, because that's going to deliver better outcomes to every single New Zealander.
That's first class. Well, I've asked this question a few times, different people on the panel. Not one person's asked for a lotto win, so I'm very impressed with the unselfishness of you all. So thank you very much indeed for tuning in. I do want to thank my 3 guests there, and look forward to tuning in tomorrow when Martin Lund and myself will be saying goodbye and wrapping up our highlights of the conference. Thank you very much indeed for watching, and thank you for coming. Yeah, appreciate that. Thank you. And that's us done. Bless you.